Welcome to today's X-Talks webinar. Today's talk is entitled Optimal Cell Line Development. Save weeks and don't reject your highest performing clones.
Hello everyone, my name is Kayla Bean. I am the Cell Line Development Scientist in the R&D Center at AGC Biologics. And before I begin the presentation, I would like to start by thanking Advanced Instruments for asking me to speak on this topic, as well as X-Talks for hosting. I'll be speaking about increased efficiency of clonal selection and CLD workflows with the Solentim ICON. I'll begin by giving you an overview of AGC Biologics and our Chef1 platform, the Solentim ICON, and how we've incorporated it into our CLD workflows, as well as the advantages that we see with the ICON. At AGC Biologics, we strive to fulfill our mission, and that mission is to work side by side with our customers in order to improve patients' lives by bringing new biopharmaceuticals to market. And we have many different ways in which we can do that, from mammalian to microbial and cell and gene therapy paths. At AGC, our services go from clinical to commercial. We have a wonderful tech transfer, collaborative approach with our customers, as well as our excellent process development, analytical development, and formulations teams. Our process validation is robust, as well as our commercial GMP manufacturing facilities. AGC Biologics is a part of AGC Inc., specifically within the Life Sciences Division. Founded in 1907 in Tokyo, AGC Inc. has more than 65,000 employees globally, from automotive products to glass and chemicals. What this means for AGC Biologics customers is the benefit of knowing that there's financial stability and backing by a large-scale global organization, which also allows AGC Biologics to expand its global footprints and capabilities. At AGC Inc., we like to say that what makes us unique is really centered around our customer-centric culture, our technical innovation, and our global facilities. Not only do we have unparalleled communication with our customers to meet their evolving needs, but we also have 25 years of industry-leading experience so that we can bring the best technologies to our customers' current and future needs, as well as 7 world-class GMP manufacturing facilities. And you can see here our global network for those 7 GMP manufacturing facilities are located, with over 2,500 employees and more than 175 customers served, from the US to Europe and in Japan. We are headquartered in Seattle, but all of our capabilities you can see across the globe. Within that, we utilize our Chef1 expression platform. Within this platform, we have our expression plasmid, our CHODE DG44 cell line, as well as our AGC Biologics media. We use these 3 components along with a specific selection strategy in order to achieve the top producing clones for our customer projects. Within our rapid cell line development program, we utilize our Chef1 promoter to give us high constitutive expression with no MTX amplification needed. We have very high cell survival and outgrowth with our macrofluidic sorting capabilities, as well as the supplement of Instagrow by Advanced Instruments. We also utilize the Solentim cell metric for high-resolution imaging to give us that clonal assurance, as well again as our chemically defined cell line development platform, and of course our excellent process development teams to further increase titer and output. As mentioned before, AGC Biologics focuses on continuous innovation, and one of those initiatives has been, like most companies, to look at how we can shorten our MAB timelines. Previous work has shown us that we could skip the 24 well and 24 deep well production model expansion that's previously done in some of our cell line development work for a shorter timeline of expansion from 96 to 6-well to shake flask production models. However, in lessening our timeline by 2 weeks, we lose the ability to have a tighter assessment mid-expansion. So we've been looking at what is a better strategy for early on titer assessment. How do we assess all of our single cell clones and move forward based on production rather than just growth itself? But at the same time, we would like to decrease our workload and increase our quality of product. Within this idea of decrease workload, increase quality, we wanted to ask some questions and how it would benefit our platform. How do we find those high producing clones earlier on? Does this sample volume benefit our small scale format of 96 and 6 wells? Does it fit seamlessly into our current workflow? Does it give us a high throughput screening method? Can we get the data to turn around fast, efficiently, and accurately? And does this method facilitate our already decreased CLD timelines? So we stumbled upon the Solentim ICON as a new technology. The Solentim ICON gives us the ability to not only check cell viability at 20 microliter samples, but also a plate-based titer assay of only using 60 microliter samples, which is great for the volumes in which we're working with. So we could assess the clone titer, cell counting, and viability using one instrument, as well as the studious software for all of our data management needs. Just to give a little bit more background on the ICON and how this assay works, the titer plates are filled with a reagent that is an IgG specific binding peptide. To perform the assay, you would add 60 microliters of the media that your cells are growing in, add another 60 microliters of your sample from the 96 well plate, mix up and down, incubate the plate in the absence of light for 5 minutes, then place it on the ICON, and within 5 minutes you will be able to read the titer of all 96 wells. This plate-based assay comes in 2 different ranges, a low range and a high range. So you can read as low as 2.5 milligrams and up to 1500 milligrams. So we had the opportunity to demo the Solentim ICON. One of the first things we wanted to do was generate a standard curve based off of our in-house MAB D37. We also had 8 96 well plates that we had single cell sorted 12 days prior, and we wanted to test those plates using the low range titer plates. And as you can see here on the top, there's an image of one of the titer assays, the data that we received back from that. We were then able to confirm clonality of all of our top clones, and within the same day, we were able to move our top 100 clones based off of productivity and monoclonality to 6 well plates. We then let those grow for a few days, and then we assessed the 6 well plates using a biosensor assay for titer assessment because we had to ship back the ICON. We then moved 35 clones into passage, 30 of our top clones at the 6 well level, and 5 of our low clones. And then we did shake flask production models where we would sample on day 7, 10, 12, 14. And here's the titer data from that shake flask production model with the 30 top clones and the 5 low clones. And as you can see in the red box, the 5 low clones continued to stay low in titer throughout the entire process, whereas we were able to achieve some good clones in our top 30. I'd like to walk you through a little bit more of the data in depth. And there's a lot of numbers here and a lot of color coding, but what I want you to focus on is the second column where it says 96 well plate ICON titer. I have everything mapped high to low on that ICON titer. And what I would like to focus on, as you can see, our high titers at the ICON level translate out through the 6 well process as well as the fed batch production model that we did. Showing that data in another format, now it is mapped to the 6-well plate titer. And again, as you can see, as you go through the process, the ICON titers that were high continued to be high in the 6-well level, and again translated into the shake flask production model. And again, here we can see that everything mapped to the highest titer in the shake flask production model. Those titers came from some of the best clones at the ICON and at this 6-well level. So here I would like you to focus on the far left column, the 96-well confluence percentage. So as you can see, it's mapped from high to low. But what I would like to focus in on is all of our top producing clones came from lower confluency wells. So if we had based our scale up and our expansion only on confluence and not productivity, we would have overlooked our top producing clones. This is another depiction of that. And as you can see, all of our top producing clones originated from wells that were less than 50% confluent. So as the confluency of our 96 well plates go down, our titers increase. This shows us that now we're focusing on clones that while they may be confluent, they're not high producers. So now we're honing in on the clones that are producing. So just to summarize that demo a little bit more, again, we had 8 96 well plates, and we were able to evaluate all of those plates in approximately 2 hours within our CLD functional area. That means there was no need to send samples out to an analytical department and wait for data to be returned back to us. It was about 15 minutes per plate from sample addition to data being received off of the ICON. We were also able to demonstrate our titer versus confluency strategy, where we could pinpoint high-producing clones and waste fewer FTE hours working with low-producing clones just because they were growing fast. Also, it helps to facilitate the AGC shortened CLD timeline of removing the 24 well plate expansion and 24 deep well plate based production models, while still giving us the ability to titer mid-expansion to keep track of which clones are producing more. Again, in summary, let's go back to those questions. Number 1, how do we find those high-producing clones? Early on titer assessment, and we have the ability to achieve that. Is the sample volume beneficial? Yes, 60 microliters for the titer assay and only 20 microliters for cell viability. Yes, it fit easily within our workflow with seamless integration. We had very high throughput screening methods. We screened over 760 clones in about 2 hours. Very fast turnaround, same day for our fast clone expansion from knowing our top titers and our monoclonality. And again, yes, it did facilitate the decreased CLD timelines by removing the 20. So with that data, we were able to move into this cell line development workflow from the microfluidic sorting to the cell metric for assurance in our growth, and into using the ICON to help us select based off of productivity, as well as utilizing the Studio software in order to manage all of this data. So having now purchased the instrument, we wanted to go ahead and do a 6-well titer validation along with our 96-well ICON assay. So again, we followed the same format as before, except for this time we were doing the assay at 13 days post-sort at the 96-well level. And we included an ICON assay at the 6-well level. And we moved the clones based off of the same parameters as before. And what you can see here is, again, it followed that same trend, that our top clones weren't necessarily from the highest confluency wells, and we were able to generate some high producing clones. And again, in this graph, it follows the same trend as before, where as the confluency decreased, the quality and productivity of the clones increased, which allows us to increase the quality of the clones we select by including the ICON assay not only at the 96 well level, but also at the 6 well level. Also, we wanted to try and reproduce this again with a different MAB, this time one that we call 100.7, and again we repeated the exact same thing, day 13 post-sort. We were able to see the exact same trend on our confluency versus productivity. Our graph showing that as the confluency went down, the titers were increasing. Having completed these experiments, we wanted to move on to other types of studies. Specifically, we'll be doing stability studies on those top clones that we were able to generate. Also, we will be looking at the normalized titer function within the Studio software. We did not utilize this in any of our previous experiments, but we're hoping that there's potential to increase the quality of our clones even further by utilizing this feature. Also, we are validating the cell counting capabilities down at the 2 mil volume to 30 mil volume levels. Also, we are looking to bring in a 384 well plate format where we can sort at that level and also image and titer using the cell metric and the icon. We're currently in the titering stage of 384 well plates to again further increase our high throughput screening for our customers. And also, there are additional assays that are being added to the ICON's capabilities, like an aggregation assay and a glycan plate-based assay, which I'm very excited to utilize in the future. So to finish off the presentation, I just wanted to chat about some of the benefits that AGC Biologics customers can receive in our CLD services. Again, our customer timelines, we do not need to send samples to AD. We have a much faster turnaround utilizing this instrument. It gives us more flexibility in our workflows, and we can hit on the slogan of our company, which is right and on time. Number of clones to be assessed can be increased. With those increased screening capabilities, we can make sure that we look at every clone possible, imaging and titering all clones, so that we can pinpoint those high-producing clones, but also give customers the confidence that the best clones have been chosen by doing a full titer assessment at all stages of expansion. And again, this is early stage development, so we have the ability to increase the productivity even further. But in conclusion, the implementation of the ICON into CLD workflows can increase the efficiency in the timelines, as well as the ability to pinpoint high-producing clones. Again, my name is Kayla Bean. You can reach me at kbean@agcbio.com, and please get to know our company a little bit more at agcbio.com. Thank you.